is just a huge honor for me to be podcast interviewing the greatest teacher from UMKC. She was my teacher. She graduated in 1983. No, I was in school 83 to 87. You graduated in 81.
That's correct.
With Brett Ferguson and Terry Harris, a couple of other UMKC legends. She attended the University of Missouri, Kansas City, where she earned her bachelor's degree in chemistry in 77. She attended UMKC School of Dentistry, received her DDS in 81. Following graduation, her love of learning in the academic environment led to a position as an associate professor of dentistry at her alma mater, UMKC. During her early days with the university, she began her private general dentistry practice, earned her certificate in oral medicine, which just became a specialty last week, and quickly rose to leadership positions within the school. She held many and varied leadership roles of the school, including team coordinator, chair of the Department of General Dentistry, chair of the dental school faculty, interim associate dean for clinical programs. Her current roles at the school are director of patient relations and associate dean of community relations and communication. Her tenure at the School of Dentistry has continued for 35 years. Dr. White became involved in the Missouri Academy of General Dentistry as her liaison to the school when she began her teaching career. She went on to serve as their membership chair, moved through the presidential line. She began her service nationally on the AGD National Membership Council, where she served 6 years, 3 of which she chaired. She was then elected by her Region 6 colleagues at the regional director for 2 terms and chaired that group for 2 years. She initiated her trustee position in 2011 and held that for 5 years. She served on both the 2010 and 2015 Strategic Planning Task Force and led the president-appointed Dental Student Task Force for the past 3 years. She was elected as the National Secretary of the Academy in 2016, a position she held for 2 years. She holds fellowships in the American College of Dentists, International College of Dentists, Academy of Dentistry International. She is active in the American Dental Association, Missouri Dental Association, and Greater Kansas City Dental Association, but now she was installed as the president of the Academy of General Dentistry as during its annual meeting in Chicago back in November 2019. My gosh, Connie, what are you going to do for an encore?
Oh, you are so fun. I don't know, but I just spoke to the National American Student Dental Association meeting, and one of the things that I told this group of young, wonderful professionals was we always have to think about what's next. It keeps us young, it keeps us fresh, and you always have to be setting goals for yourself and making yourself better each day. So I really need to think about that. This past year, I was offered early retirement at the University Dental School here, and I had already even signed on the dotted line and said I was going. And I looked out at my dental students' faces, and I just said, you know what, I can't go yet. I have more to give. So I walked away from early retirement and decided to stay at the university. And so now at this point, I'm serving as the clinical dean here at the School of Dentistry. And I'm enjoying that role. It's certainly really, really busy, but I'm loving it. And, the sky's the limit. You just never know what you're going to do next.
Well, Connie, I really was so excited to have you on today because, you graduated in 1981, and that was the worst economy I've ever lived through. I mean, Paul Volcker was the Fed chairman. Interest rates hit 21%. Unemployment was, and inflation was both double digit. And right now, we're getting hit with kind of a triple whammy. You got the coronavirus. You have a stock market. Obviously it's contracted, and you have a lot of highly leveraged dentists that walked out of school with $400,000 of student loans. So they're debt leveraged. They're getting smacked with economic contraction and a coronavirus. You and I have lived through 4 economic contractions: 80, 87, 2000, Lehman's Day. What advice, what calming, loving advice would you give to the young kids who are looking at the scenario today and saying, holy moly?
You know what I would say? I would say that our students coming out of school are the best and the brightest we've ever had. They're energetic. They work hard. They have good hearts. They're fantastic, and they are challenged. But I think practice models are changing rapidly around us, and I think there is opportunity. I still believe that dentistry is the best profession out there for young individuals to embark on. I tell my students every day that they will make it and they will do well, but they have to just take it one day at a time and not get in a panic mode and not think they have to have it all yesterday. I think sometimes we all get a little impatient with life. But I think you just have to take it one day at a time, just as we did. Our debts were not as high, but when you look at the economic downturn that we faced in the early 80s, many of our challenges were the same. And yet we all did well. And if you're going to do well in life, dentistry is the place to be. So you have positioned yourself for great success. And you just have to do one day at a time and give it everything you have each day, and stay focused on what is in front of you. What is it that I can do to best serve my patients and my community today, and the rest will all take care of itself over time. It'll improve. I got home from work yesterday and my husband said, we lost a ton of money. And I said, well, you know what? We'll make it back tomorrow. You just have to be positive and work hard each day, and it will turn around again. And if anybody's going to do well, this group will do well. That's what I would say. I have every faith in them.
So, Connie, when you graduated from school in dental school, UMKC Dental School in '81, did you see yourself a woman in a male-dominated profession, and how does that look now at 2020?
Well, it's kind of interesting because in my class, we had 160 in our class back in those days, and out of the 160, there were 10 women. And so we really were in the minority. But, I have to tell you, my best friends in dental school were my guy friends in the class. And I never really saw myself as different than them. I really didn't. I was just kind of friends with everybody. And I didn't really feel particularly challenged that way. I know some of my classmates probably did, but I never really felt that particularly. There were some challenges, of course, and we had to deal with some things. But everybody deals with things in dental school. Dental school is hard. Dental school is not easy. I don't care who you are, and I just think that we all just give it the best we can each day. And I don't see myself as different. I will tell you that the culture is, and the environment is very different. In our current class of 110 students, I have more women than men.
So the class size now is how many?
Well, we have 110 in our current dental school class at UMKC.
What number is that? The freshman year? That's 2020? Or are you talking about?
Yeah, I mean, we have 110 for the last 4 years.
Okay, 110.
And the incoming class for this coming fall will also be 110. And of that 110, we probably have, probably 57 women. So, we have a majority of women in the dental school class, and, everybody just is independent and does their own thing. And we really, it's really not viewed positively or negatively. I mean, it's just people are people. And I will tell you that our classes have become much more diverse. I always tell the young people when I grew up, I was in a small town in southeast Missouri, and everybody was white and Catholic. And middle class. And I have certainly learned the love of diversity and inclusion, and have enjoyed so much the diverse nature of our dental school class now. We are an extremely diverse student body, and we have people from a number of different states that come to our school, and some that originated in several different countries, and it's just lovely. It enriches all of us so much.
Yes,
So
and
it's
I
wonderful.
remember my boys even picking up. We visited a lot of countries over the years. Going with Dad when he was lecturing, and a lot of countries like in South Korea, they're all South Koreans. You go to Japan, they're all Japanese. Even Poland is almost all Polish, and the diversity of a country like the United States or Canada is it's just rich and fun in music and theater and sports
Yeah.
and
But I don't think But I don't think we need, I didn't mean to interrupt you, but I don't think we used to see that in dental school. I mean, in dental school in 1981, it was mostly white men. When I think back to my class of 1981, it was mostly white men. And it's much more diverse now, more than half women. We really are represented by many different peoples, and it's just wonderful. It's just really been an enriching experience for our school.
So, Connie, how many children did you have? Did you have any?
We have 3 kids.
Okay,
3 kids.
I got to ask you a question that I'm not qualified to answer, but we get it all the time. A lot of when I'm in these dental schools, a lot of younger women are painfully wondering. They want to be a great dentist, but they want to be a great mom. And they're always asking, what's the easier path to be a great mom? Just work for somebody else, work for a DSO, so you can leave everything there 8 to 5, Monday through Friday, and go home and focus on mom, or own your own practice and be a mom. Which strategy do you think works better?
You know what? I think no matter what you do, I'm going to say this first of all. I think no matter which path you take, you have to have a lot of support at home. It has to be more than 50% help. We lived here in Kansas City and didn't have any family here at all. Our closest family was 6 hours away. And, my husband and I managed 3 kids, and both of us working full time, and we just worked it out. I mean, and I was really in a position where I was 4 days a week teaching and a day a week in the practice and doing research and all the other things that I did outside the school. And we just managed it. I mean, when he traveled, I was home with kids. And when I traveled, he was home with kids. And if somebody was sick, I took Monday morning, he took Monday afternoon. And I was in a position at the School of Dentistry where I didn't have a tremendous amount of leeway in going home with sick kids. I mean, I had patients and students, and I didn't work for myself. So I worked for the university. And so it wasn't always easy, even in a teaching position. But I would say that, you have perhaps a little more autonomy in your own private practice where you're kind of running things. That might be, there might be some tremendous pluses there. But I think the negative side of that is that you are directly responsible for the financial pluses and minuses of that practice, and you've got to make payroll. And so when you're not in the office working, the clock is ticking, and you've got staff that are needing to be paid. So I think it's a struggle. I think it's a struggle either way. If you're working in a corporate situation, you don't maybe have the leeway in being gone as much, but you also don't have the burden of running your own show. And so, from that standpoint, you don't have the financial burden, and you're paid a salary, and you have a little more leeway that way. So I think there's pluses and minuses to going both directions. But I can tell you, when I first got out of school and the teaching opportunity was open to me, and I could practice, 1 day a week, that was very attractive to me because I was being paid a salary. And I felt personally that I had a little bit more leeway in my position at the university, and I could practice a day a week or not. And so I had just a bit of flexibility over the years. And of course, the university's been wonderful to me. But you just gotta have a partner in crime to help you work these things out. I mean, it just, we had some weeks where by the time we got to Friday, we were dead dogs. But you got to work it out. You got to have support. That's what I would say above anything and everything you choose.
So whenever there's a change, there's a change in the environment. It's an opportunity. If someone asks you, what was the top 1 or 2 or 3 weighted changes as dental class size went from 10% women to more than half women? Some people speculate that a lot of women will fuel a lot of employees, so that'll help DSOs.
Yeah.
Some think the public, it'll reduce the fear because a lot of people are less afraid of women than men.
Yeah. Yeah.
What top 3 variables would you say the change in demographics from male to female have made and will continue to make on dentistry?
Wow, I think that's really an interesting question. I'm going to tell you that that our women students, they're different. They are just, I think probably some of their bit of demeanor at the chair is a little bit, maybe perhaps a little bit more nurturing. And they're loved so much by their patients, and they are just a beautiful example of working with patients and creating an environment that is welcoming, and there's just so many wonderful things. Now, that doesn't take anything away from the male students, but I just think the women students bring a real difference to the chair in practicing dentistry. I just think they have some empathies for some things in life that some of their male counterparts may not have had over the years, especially with many of their women patients. And so I think they bring a beautiful dynamic to the chair. I will tell you that some have argued that you may see a difference in the workforce. But I personally have not, I mean, and when I say a difference in the workforce, I'm talking about, maybe people, some of the women maybe not working as many hours or working less days a week, perhaps, than some of their male counterparts. But I really have seen my women students, the majority of my female students, working 80 hours a week and in practice 5 days a week, and they're just going for it. I mean, they just have fantastic work ethics, and many of them are choosing to own their own practices and buy into their own practices. And so I think it'll be interesting as we move through into the future to really look at the statistics on that and really get down into the numbers and see if it really has changed the dynamic of the workforce. I would contend that we will find in the long run that it has not changed the number of available dentists that are working or how many hours they're working. I think you're not going to see that much difference, because I think, women who aspire to go into dentistry are just women that are, super go-getters, and you're just not going to see women who graduate at those levels and are at home. I just don't think you're going to see it. So, I think that you're not going to see that much of a change in dynamic that way. I will tell you that that the variance in what they bring to discussions at the table are just fantastic, and they're just a wonderful mix with our male students. I mean, it's just really back on the diversity issue. I really think that they bring a wonderful diversity to really instruction in the classroom and in our preclinical laboratories. We have many of them who are TAs, and they work with the male students as TAs, and they're just fantastic. Fantastic. And you know, they are succeeding in the specialties just as the men are. Many of our women go into specialty programs, AEGDs, GPRs, and they're just succeeding on an extremely high level. And I think you see that when you look at associations and you look at the last presidents of the ADA. You know, you've had 3 or 4 women presidents of the ADA in the last 5-6 years, and so I think you're seeing women who are getting out there and really succeeding and managing well in a man's world.
Very, very interesting perspective. I want to drop to another subject. Student loan debt. You're been in university a long time. Do you think? Well, first of all, what is the current difference between a public institution like UMKC versus, say, your closest neighbor private would be, I assume, Creighton? What's the difference in tuition between public school subsidy like yours?
It's quite a bit different. I asked somebody the other day what our tuition is per year, and I think it's about, I'm going to say maybe 40,000, and really for private schools we're looking at 75,000. It's probably at least double, and some private schools are even higher than that. Better than 100,000. Some of the East Coast schools are better than 100,000 a year. So you're seeing dental students in some of these private schools getting out of school really with debt that exceeds, 500,000, 600,000. Some students are getting out of school with that much debt. And that kind of debt, you can appreciate it would be hard to manage. Think about getting out of dental school and buying a $600,000 home. I mean, and then on top of that, you're purchasing a practice and you've got the debt from that. And that's before you buy your home. And I mean, that's before you do anything. You've got a significant debt. So this is what I'll tell you about student debt. I think student debt is affecting the choices that our students can make when they get out of school. I think that they're more restricted in what they feel they can do because of their debt. Now, one of the things that we're really looking at from a legislative standpoint is we're looking to decrease the debt load from student financing. They're charged interest while they're in school. And that is significant with those kind of debt levels. The amount of debt that is accrued due to their interest level being charged the whole time they're in school. The entire 4 years, all their federal loans, they're paying interest the whole time they're in school. That is a really significant addition to what they've already taken out in debt. And so, it's kind of interesting, when we were in school, I mean, I still laugh about it, but, in my early teaching days, I'd get in the car with my hubby and 3 kids and 2 dogs, and we'd drive across the state for Christmas and spend the Christmas with the family. And my students would come back from the Bahamas, all brown. And but I think they're just in so much debt that they figure, what's another 10,000 on a trip, you know what I mean? Because they're already so debt ridden. So I think their approach to their debt management is sometimes they could use a little help, but they're really strapped. I mean, now our students coming out of UMKC are really not in that kind of debt, but your East Coast and your West Coast students, yeah, they very easily could have $500,000 in debt when they get out of school. And you just wonder how long we can sustain that. I mean, will it continue to increase over time? My lights are going out. But you just wonder how long that kind of debt is sustainable.
I want to ask you another question, which is very Interesting. When we look at dentistry over profession, over a century, we just saw this year. I mean, last week, oral medicine is recognized as a dental specialty, become the 11th specialty, and now joins dental anesthesiology, which just got added this year. Last year, dental public health, endodontics, oral surgery, pathology, radiology, orthodontics, pediatric, perio, and pros. If you go back to 1900, there were no specialties in healthcare, and it was only 1% of the GDP in 1900. By 2000, dentistry had, 9 specialties, MDs had 58, and it was 14% of the GDP. Now we're at 2020, and dentistry has 11 specialties, and medicine has over 60, and now it's 17% of the economy. So you see that the people realize that the only wealth is health, and if you die, you have nothing. That's why everybody will spend every dime they have if it meant avoiding death. But now you have kids coming out, especially ones that join the AGD, like I did. I have my fellowship in the AGD, my mastership in the AGD. But they want to be a super dentist. They want to go back to 1900, where they're the periodontist and the oral surgeon and the pediatric dentist and the oral medicine. And how does a child try to pick a career between focusing and being all things to all people? And I want to add one more stat before you weigh in. That is the average net income for general dentists in America for specialists is $320. General practitioners, it's $197. If a dentist owns their own practice, they make $244, and if they're employees, they make $144. So in macroeconomics, it's already a $100,000 a year benefit to be a specialist instead of a jack of all trades, right. And it's another $100,000 reward if you own your own practice versus not. So she comes out of school, and she wants it all. She wants to be a pediatric dentist, Invisalign, implants, endo, veneers. She wants to be a jack of all trades. Does a jack of all trades work? I mean, are we going back to 1900 with no specialties, and here comes Superman? He just jumped out of a phone booth and he can fix anything in your mouth?
Well, I think I will tell you that I love the general dentistry model that we have in this country, and support it a lot through my role in the Academy of General Dentistry. I think it's doable. I think there are a lot of challenges that are coming our way, environmental challenges that really, have a potential for hurting general dentistry. But I'm going to tell you something that I think that I see as I look at the landscape. The practice of medicine has become so, I'm going to use the word fragmented in its specialization, that no longer can you go, very rarely, to see one person that takes care of everything. I was reminded of this so much when a short time ago I was trying to help my dad, who had a massive coronary, and it just so happened, he was in Kansas City visiting me when it happened, and he saw the cardiologist, he saw his cardiac surgeon, he had a pulmonologist, he had a vein guy, he had an internal medicine guy, he had a general practitioner that took his blood values. He saw so many people that I couldn't work trying to get my dad to all of his appointments. And what you hope for in that kind of scenario is that they're all talking to one another. Because, when we finally got him back to my hometown in Southeast Missouri, all those people were in different cities. And Daddy and Mom were traveling all over the state trying to get him to all of his appointments. And yet we still had troubles getting one person to talk to the next person. So I think that general dentistry, one of the beauties of general dentistry is that by joining the Academy and really becoming what I would call, just really a kind of a super generalist, we can be there for our patients and really, really define the word treating our patients comprehensively. Because I think that I worry sometimes that we are headed down the road of medicine in that care is so fragmented. You know, you go to see a physician for, you know, that has to specialize in ankle surgery, or you go to see somebody that takes care of your wrist. You know, I mean, there are so many physicians that specialize in so many different things that I think we lose sight of total wellness. I really do, and I love the fact that general dentists really can be there for their patients. And certainly we need our specialists. I'm not, you know, we need some of our specialists to really guide us when we have extremely complex situations. And, you know, we love them here at our school as well. You know, we have consults with our specialists all the time. But I do think that we have to be careful about fragmenting our patients' care. And we lose a sense of our comprehensive ability to care for people's total health. And I think that it's hurt medicine, and I don't want it to hurt general dentistry. But some of the challenges in the environment are making it harder. That's for sure.
Interesting. So oral medicine became the 11th specialty, and you, that was your area. I mean, you were into oral medicine before
right.
it was
Before
cool.
it was popular.
Before it was popular. What did but what you're talking about? Well, first of all, a lot of young kids ask why and why now? Why did you ever think it'd be a specialty in your lifetime?
I never thought I would see the day, because there was so much backlash about, you know, providing more specialists and in different areas. And, you know, oral medicine has tried for many, many years to become a specialty. And I'm really happy for them. I think it's, you know, it's wonderful, but I honestly never thought it would happen. The reason that I went into the specialty is because I really wanted to gain increased knowledge to be able to help my patients really with a lot of their medical needs. You know, in oral medicine, you really study the science of medicine, of your patients' health histories, and learn you know, about oral features that are normal and abnormal, and I really could be a huge benefit to my students. Of course, I taught all of the disciplines in the clinic for many years, but I was particularly helpful to students about education of their medical complex medical situations, which I think each of my general dentistry students will face, and equip them maybe just a little bit better to be able to understand some of the medical complexities that affect their dentistry on a day-to-day basis, and also really to understand really some of the more common oral maladies that we see. You know, it's interesting for many of the people who listen to your podcast who are from our area. My mentor for my oral medicine certificate was Charlie Dunlap. And for those of you who remember him, you know, he was just fantastic. And I really felt that I even got really a touch of oral pathology in my training. So it was excellent. But I really think I really gained knowledge in that specialty so that I could really help my students be better general dentists. And it really was a real plus to understand, because when you're in an environment where you have a lot of complex patients with, you know, I think our patients today are becoming more complex medically and dentally than we've ever seen in our lifetime. And I think you have to be equipped to be able to treat those folks that come into your door. And what better way than to have some extra skills in that area to be able to do that? Because I think you want to be able to treat those patients safely. So I think as a general dentist, the work you do every day becomes more and more complex to be able to handle patients who, for whatever reason, have put off dentistry for longer, and their needs really become much more complex.
So how will oral medicine be a specialty change the day-to-day practice of your regular old dentist down the street in the next few years?
Well, I don't think it will. I think that it serves better, and I may not be able to answer this fully, but I think that it serves better those folks that are in academic institutions, and it really formalizes, in my opinion, their training. I think sometimes in many institutions you have some political infighting between oral pathology and oral medicine. And so I think it helps to substantiate their training and solidify. But I see it being having more of an impact in hospital settings, in big, VA medical centers and complexes where they have dentists hired to do the dentistry. And I think it solidifies their training.
Well, that's a brilliant question. What is the main difference between oral medicine as a specialty and an oral and maxillofacial pathologist?
Well, boy, oh my gosh, that's a really loaded question. Well, from a traditional standpoint, I think oral pathologists really study disease states, from a cellular level, and they really spend a great deal of time looking at these disease states microscopically and looking at pathology specimens to determine a correct diagnosis. Some will tell you that they have no business in the clinical setting. Some oral medicine people see pathologists in a laboratory, looking at specimens, looking at samples that have come in from private practice to their pathology service, where they are just studying, slices of tissue for a correct diagnosis. But, our pathologists at our School of Dentistry really have spent their lifetime, and I speak of Charlie Dunlap and Bruce Barker, really have spent a great deal of their lifetime counseling patients at the chair and looking for oral lesions, particularly, oral soft lesions and bony lesions both, and really helping students to address those maladies. Oral medicine, on the other hand, have a distinct training in dealing with patients' health, medicine, pharmacy, really helping to understand the complexities of medical issues with patients. But they also now are getting training at chairside in diagnosing oral lesions. They may not have as much pathology, perhaps as far as cellular level examination, but I think oral medicine absolutely is at the chair looking at patients' oral lesions and determining what we're seeing, especially related to their medical standpoint. But you can see where those things cross over.
So a lot of the younger kids might not realize this, but back in the day when they came out with a new specialty like endodontics, some of the most famous endodontists of all time that never went to endo school were grandfathered in. I believe the founder of Tulsa Dental Product, Ben Johnson in Tulsa, Oklahoma, I think he was grandfathered in. Another one that comes to mind in Chattanooga, Tennessee is the John McSpadden. You earned a certificate in oral medicine back in the day. Will you be grandfathered in and become a specialist?
I haven't even asked the question, but I would tell you probably no. I don't know.
Well, you need a better attorney.
I think it's probably going to be a series of oral and written exams, and I'm sure it's going to be very complex in trying to become boarded.
What year did you get your certificate in oral medicine?
I was trying to remember the other day when it was, but I think it was probably close to about 87, something like that, because I'd been out for a while and I'd started my practice and I was teaching, and so I think it was around that time frame that I actually finished it. But I went part-time. I did it while I was teaching, And so I took classes, 2 days a week with Barker and Dunlap, and I did, statistics, and I did all the coursework that somebody in perio or endo or, any of the other specialties. I did all of the training from a lecture standpoint. I did all those kinds of didactic coursework that all those specialties do. And then I worked, in oral medicine with Dr. Dunlap in the clinic. And so that was where I did my oral medicine training. But
they were known around the whole country as Dunlap and
know.
Barker.
I know. And they're both retired now, of course. Dr. Barker is still coming in and helping out part-time, and he works in our biopsy service. So he still looks at specimens and does diagnosis. He's not on the clinic floor anymore, but he is, I think, 2 days a week at our school, still working part-time. And Dr. Dunlap is totally retired now, so he's not at the school anymore at all. So, but you can see where oral medicine and oral pathology sort of cross, because much of their training, overlaps. And so in some institutions, there's some bit of, political, I won't say infighting, but there's, there's enough crossover that sometimes they get a little bit crossways in trying to figure out who should be doing what. But I think in this regard, especially the specialty of oral medicine will help in some degree to solidify their place in the dental community.
Is the AGD headquarters in Chicago, is it in the same building as ADA? Is it 211?
No, it used to be. We used to be at 211 East Chicago Avenue, and we purchased our own building probably, I don't know, it's almost close to 10 years now. We're over on 560 West Lake Street, which is over on the west loop of Chicago, and sort of an up-and-coming area. We purchased our own building, and we have several floors of this building, and we have several businesses that lease from us that are in the building as well. And so it's beautiful. It's so nice. It's wonderful to have your own office. So I have an office there, and I spend a fair amount of time in Chicago.
What do you think the AGD represents general dentists better than the ADA? Does some people, the old argument is that the ADA is more concerned about specialists and the AGD is more concerned about general dentists.
Well, here's what I'll tell you. Here's what I'll tell you. And I was asked this question this past weekend when I was in St. Louis for the ASDA meeting. I encourage students to belong to both. I belong to both. I've been an avid member of both organizations. I will tell you that that ADA is the largest of the organizations by far. I think they have 147,000 members, perhaps, something like that. And they have a fairly good market share of about 67%, but they do represent all of the dentists. They represent the whole group. But I think when you represent the whole group, I think perhaps that there can be a lot of value gained by representing just the interests of the general dentist, which is what our AGD does. I think we have a lot of environmental challenges that face the general dentist that may not be of as same importance to somebody who's an orthodontist in Leawood, Kansas, or an endodontist in St. Louis or wherever. It's just different. We have different needs and different concerns. And so I think it's really nice to have an organization that really represents specifically the general dentist and the challenges that we face. Now, that being said, I think the strength of the Academy of General Dentistry is in the continuing education that we provide. And it really does, it's a game changer in my mind for giving us really an important sense of increasing knowledge every day, being really a lifelong learner. And I really think that the emphasis that the Academy, and really the basis for why the Academy was formed in the first place, was really to support further continuing education for the general dentist. When I got out of dental school, I remember having been out of school about a month, and I'd crossed the stage and mom and daddy were there, and it was an exciting time. And I'd really spent since about kindergarten getting there, and I finally got done with dental school. And then I remember saying, what now? What do I do next? And, every dentist ought to be asking themselves that question, what next? And for me, I joined the Academy and I started working toward my fellowship and my mastership. And it was so wonderful because it made me a great general dentist. And it certainly made me a better dentist than I would have ever been without it. So, in my mind, that is the true value of AGD, is the continuing education and really, and it's really credentialing of the general dentist, in my opinion, for their efforts in becoming better at what they do.
So let's talk about the other 400-pound gorilla in the room, the coronavirus. What are you seeing on the streets of Kansas City? Are people not coming in for their appointments at UMKC Dental School? Is it what's the status right now of the coronavirus when this is March 10th?
Well, I think there's a lot of fear. Which is driving a lot of people to be concerned. But I will tell you that some of that fear, it becomes legitimized on a daily basis when we see huge meetings like the American Dental Educators Association meeting, which annually probably has 4,000 people. I don't know how many people come to this meeting, but the meeting was happening this weekend and it was totally canceled this week. And so when you see that kind of thing happening, it was to be in Maryland, Baltimore, Maryland, and it was totally canceled. I mean, it's got to have cost them millions of dollars to cancel that meeting. I mean, when we saw that, we were just like, whoa, and meetings are being canceled all over the country, and there's just sort of a sense of hysteria. So far, it has not affected our patients at the School of Dentistry. I worry about that a little bit because many of our clientele here are older patients who are compromised medically, and they are the very group of patients who are being hit the hardest by this. We have one case right now in the state of Missouri. We have one confirmed case in the state of Kansas in Johnson County. And that's where it stands at this point. But I think when you look globally, it's sort of a storm that's probably coming. And so I think the university is looking closely at this possible pandemic, and I think that they're being very proactive and thinking about what we do if we have to be out of here for some time. I'm not saying that that's what's going to happen, but I will tell you that they're looking very carefully at really making sure that faculty members understand how to put courses online. They're helping faculty with trying to panopto their lectures and really transfer all of their lecture type courses online for students in case we have a time period when we can't be here. So we're working in that phase right now where people are going to be working on their lectures and getting that kind of thing taken care of. Of course, what do you do with clinic? We have boards coming up in 2 weeks. We have the REBS exam March 26th through the 29th here at the School of Dentistry. And, what are you going to do with that? I mean, right now it's fully planned. We're all guns on board for having that exam. The students have their patients all scheduled. And so far, we're moving ahead. We're not canceling that, and we're moving forward. So we'll see. We hope it does not impact our patients that are coming in. Like anything else, people are going to not come if they're worried about getting sick.
So
and we have to protect. And we have a big important step to take to secure the health of our patients. So we will do whatever is necessary at a given time.
So, how, if you were, you're the president of the Academy of General Dentistry, if you were the president of the Hinman Dental Meeting and you have a big meeting coming up, this is March 10th and March 19th through the 21st, that's the biggest dental meeting of the year for the entire South. How would you wrap your mind around this? Because I know a lot of people are viewing this differently. Some people like the China and Italy are quarantining.
I know.
And America, I thought it was hilarious when the governor of California and Washington said, we need to treat this 100%, and they didn't even close down Disneyland. I mean,
I know.
China wouldn't have left Disneyland open. So some people say that, that doctors should be leaders and there's no reason for it, stay at home. And other people are saying, no, come on, the show must go on. And how would you wrap your amazing mind around this?
Well, I think
decision?
it's hard to speak about that in isolation, but I tell you where I would start. I would start looking at who my speakers are. Who are my speakers? Where are they coming from? And are they still coming? That's where I'd start. Because without your speakers at Hinman, you got a problem. That's where I'd start first. And if my speakers are committed to coming and I'm not getting a sense of a lot of cancellations, I'd move forward with it. I think there's a lot of panic that's probably unnecessary. I think people are it's bulldozing. And I think people, one thing leads to another, and all of a sudden people think the sky is falling. And we're just not seeing the numbers that support that right now. That's not to say that things couldn't change tomorrow. And I think we have to be smart, but I just can't, I wouldn't do it. I probably would move forward with it, not knowing any more than I know right now. I would probably move forward with it.
And you became the president of the Academy of General Dentistry. That is, what an accomplishment. What would you say the top 3 goals are, or top 3 challenges for the AGD going forward?
Well, I think I think one of the top challenges that we face in general dentistry right now is really looking closely at our workforce. I could go on about this for quite a while, but I think that people who try to redefine workforces to manage what they perceive to be shortages in providers are looking at the entire thing short-sighted. And I think that that we have to be more creative than creating another workforce model. And I'm speaking specifically to dental therapists. I have a lot of concerns about creating another layer of the dental team. When I see dental students getting out of school who are looking for wonderful opportunities in some of those communities, and instead hiring a dental therapist who is come straight out of high school and maybe has 15 months of education total, who is doing irreversible procedures, surgical procedures on patients who are more complex dentally and medically than perhaps we've ever seen in this country. And yet I have students who have spent 8 years plus getting to the point where they are to be safe, wonderful general practitioners. And we have a lot of them. We've opened, 20 new dental schools here in 2020, and we've got a lot of people graduating dental school. And we're going to need to have people out there in that workforce that can do these things, that have been trained to do these procedures. And I think to create a second tier of provider is a huge challenge in general dentistry. I see it as a huge challenge because when we look in some of the states, particularly Minnesota, the dental therapist was created there to fill a niche for patients who were not seeing general dentists. Well, guess what? They're not out in the rural areas treating patients that are not getting care. They're all in Minneapolis in dental offices, providing a second tier of level care for their patients. And you're probably gonna get some pings about that, but I tend to have an opinion about that, and that is my opinion, that we certainly do not need another workforce model to take care of that. The other challenge that I see that is coming down the pike, and I just came back from Washington, D.C., where I spent a couple of days on the Hill. And one of the challenges that I think our dentists in the community really need to take a stand on and really think about seriously is the fact that we are getting, I believe, closer to folks trying to establish dentistry in Medicare. Huge. If you talk to our medical colleagues, they will tell you that it has not been a good thing for medicine, and that it is not a sustainable financial model for dentistry. And remember, too, that a lot of these patients that we would see in a Medicare model have had complex dentistry for years on dental insurance plans, and they're not coming to you to have one tooth out. They're coming to you because they have 4 implants that are loose. And what do they do now? And they've got crowns and complex, hybrid bridges and all kinds of crazy dentistry. And all of a sudden, they're coming to you thinking that Medicare is going to take care of everything for them, and you can afford to do a cleaning for them. So I think Medicare in dentistry, is another biggie. And then I think the fact that we have our general dentists coming out with such high debt that it limits their choices for what they can do in dentistry. And I think that many of our practitioners who are our age, Howard, I'm going to include you in my age because you're close enough, that have these wonderful dental practices, and students can't afford to purchase them. And instead they're going to other models. And I worry about our private practitioner model that is challenged, because I think they're paid tremendous bonuses, and they're going to many of these corporate practices, and they're going to work their tails off for the amount of money they're being given. But they're going to start from seeing one patient in the morning and one patient in the afternoon to seeing 25 patients a day. And it's going to be a real shock to the system. But I think they're in a position where they feel they don't have a lot of options. One of the other things that, if we have time, that I want to mention, and that is that I think our country is facing a tremendous challenge in education of our students. When you see folks like me in the dental school, I'm not the youngest anymore, but I'm darn near close, and I'm 65. You don't have people coming behind me who are teaching our students dentistry. The young people cannot afford to go into dental education. And so you're seeing a huge void across this country in dental schools. We are desperate for good folks who can teach dentistry. And you don't have to have a specialty training. You could start part-time and see how you like it. It certainly isn't going to pay you what it pays you in private practice, and that's part of our challenge. But it's a tremendously wonderful life to do what I've done. And, it's the best job in the world. And especially for those folks who have had an opportunity to be in practice for a number of years and they're thinking about a change, dental education is a wonderful, wonderful choice for them if they're anywhere close to a school of dentistry, because we need you. We need you desperately to carry on the tradition of great dentistry in this country. And without you, I worry how we're going to teach the people coming behind me. It's one of the reasons I didn't leave, because I wasn't sure who was coming behind me.
Wow, that is so cool. A lot of, you talked about the difference between what percent of physicians are members of the American Medical Association versus what percent of dentists are members of the ADA. Do you know those numbers off the top of your head, or thereabouts?
I can give it to you closely.
Okay, what is it closely?
The ADA is about 67, 68% market share. Something close to that. I'm not going to swear that I'm right on the money with that, but I'm pretty close, I think. The American Medical Association, on the other hand, is 17%. it's declined tremendously. And what I think we find in medicine is that they are highly engaged, if you will, in their specialty fields. You know, I have a daughter who's a med peds, and all of the journals that she gets are in internal medicine and pediatrics. And, you know, she's not a member of the American Medical Association, probably never will. And it didn't even cross her mind that she should be doing that. So, you know, I think, you know, American Medical Association the numbers are very low. I want to say they're 17% and probably falling. Well, AGD is not nearly as high. The AGD is probably, I think we're probably right now at about 22%, 23%, something like that. So we're much lower than the ADA. There's no question. And so we need our AGD, our ADA to help us with advocacy, and we work together with them closely on many, many advocacy efforts because it takes numbers to advocate. And so we work closely with them on many of our initiatives, you know, fluoridation of water and you know, many of our, you know, amalgam versus composite situations where we have people who are concerned about amalgam in the environment, and any number of issues, the Medicare issue, and many of the issues that we face. We are in concert with ADA on many of those issues. We're not exactly the same on all levels, but we work closely with them on the advocacy for our members.
Well, the point I was going after is one of the big lessons learned from the AMA losing over 80% of their members is that a lot of nonprofits try to diversify their income stream, and they don't want to be dues dependents. And you've seen the largest ADA state association, the CDA, they diversified their revenue stream by the development of the dentist insurance company, and now they've launched the dentist supply company where they're selling supplies. Do you think the AGD should try to find another revenue stream to augment their existing dues membership revenue stream?
Well, I think we have tried to do that. I mean, I think, you know, it's a member of surviving. it's a not member, a matter of surviving. You know, I think that we have looked at non-dues revenues closely, and you know, we have worked closely with some companies, and we, you know, we work with several insurance companies, and so we worked closely on some of those non-dues revenue in order to just help us with our bottom line. And but we're still extremely high dues driven. And you know, we have a scientific meeting every year, which, by the way, I'm going to put in a plug, is in Vegas this year in July. It's the week of July 15th through the 19th. And so, you know, we have exhibitors, and we work really hard to produce a wonderful meeting for general dentists. We're working out of Caesar's Palace this summer. We have Jim Kelly as our keynote, who's going to be speaking on his oral cancer venture.
Really? You got him from
Yes.
Buffalo?
We're so excited. Jim Kelly's going to be there. I'm going to be on the stage interviewing him.
Wow.
He is a 2-time oral cancer survivor. And he has some wonderful messages for general dentists about his journey. And he's a motivational speaker, and he does quite a performance. I think he was at Hinman a couple of years ago, but anyway, he is coming to our meeting, and he will be our keynote, and he will be speaking about his oral cancer journey. He can't stand at the microphone anymore and just speak because he has an extremely dry mouth from all of his treatment, but he enjoys answering questions, and so I will be sitting with him on the stage to interview him, and I'm looking forward to it. It's going to be great. But anyway, getting back to, we have a large scientific meeting that we support every year, and helps to support our endeavors. And so I do think that out of necessity, you have to have some diversification in your revenue stream in order to provide the best the best bang for your members' buck. I think you have to provide member value for folks. And, people want different things out of an association. Some people just want to be checkbook members. Some people want the advocacy that you provide, and they come with us when we go to DC. Some members love the state, the state association. And some members really, the large majority of our members love the CE that we provide and our fellowship and our mastership. It's still at the core of what we do. And so, but I do think that you can lose yourself in some of that. I think you can lose your purpose. And I think you have to stay true to your purpose while you're doing some of those things on the side.
So did Jim, in getting him to lecture, did he talk about what he thought the origins were of his oral cancer? Did he think it was HPV, secondhand smoke? He didn't.
We're hoping that we hear some of that. And he's had kind of a sad life since his days in football. He lost his only child to a rare disease, and he died when he was 10 years old. And he talks about, a 2-time battle with oral cancer. And he is a very extremely motivational speaker and teaches people to stand again and get up again when you think you're going to get up in the morning and you're never going to see the light of day again, which he's had some of those days. And so we're looking forward to him coming. He's wonderful. He's going to have some autographed footballs that he's going to be throwing out to the folks in the crowd. And so we're looking forward to having him there. He's going to have a private meeting with folks who would like to join him after the lecture, and he's going to be supporting our foundation through that. So our foundation through the AGD is our goal is oral cancer. That's what we raise money for, is oral cancer through our foundation. So he was excited to be able to support our foundation and be there for us for this meeting. So it's going to be exciting.
Wow, that is so cool. I know Ivoclar is very close to Buffalo, and I noticed that every time I was at the University of Buffalo Dental School or up in Ivoclar for years, I mean, going back, at least 5 or 6 years, everybody was always wondering, what's the actual details of that. And it was a private matter. I get that, but it's very, very interesting.
I love that.
Coronavirus, HPV virus. It's turning out these viruses are have bigger impacts than we might have thought.
Yeah, isn't that and the other thing, you were talking about the coronavirus. I think one of the things that people are really concerned about, Howard, is the fact that there's a lot of unknowns. Testing has not been adequately done. We're not really prepared for testing. And I think there's concern that it will mutate. And I think, that's one of the other things, because I think they've already seen some of that in this particular virus. So I think it's fear of the unknown, and people, worry that this is going to be the thing that takes us out, And I said, the truth of the matter is half of us are probably walking around with it right now. We don't even know it, so, and for many of us, it'll be like a cold or a small flu, and we'll be on our way, but, I just think there's a lot of hysteria, and I think it's probably largely media driven. But regardless, we're seeing huge impacts especially in professional. I think you're going to see a time when you're going to see patients who don't want to come in.
Right.
I think it reaches a peak. That's what you're going to see.
Right. We're seeing the economics and the politics of fear right now. In a big
I would
way.
agree with you.
So that meeting, I'm going to help market that meeting for you. That's going to be at Las Vegas, July 15 to 18 at Caesars.
Yeah, that's correct. We're really excited. We have a wonderful space there. We're going to be having a wonderful president's reception. Jim Kelly will be our keynote on the first evening. So I believe that is the evening of the 15th. And then we'll have an opening to our exhibit hall. We're really excited. We're going to be having all of our tables, Las Vegas gambling tables on the exhibit floor, and they're just going to be like practice tables where they can show people how to play. It's going to be really fun. So we're going to have quite a party, and Caesars is a great venue, and I love Vegas. I think it's one of the most fun cities out there. So I'm looking forward to it. It's going to be a real celebration of my presidency, and so we're looking forward to it. I've got a lot of dental students. Dental students can go free. And so it's free of charge for students to come. And so particularly for people who have dental schools out in that area, I mean, they can just come on over. And a lot of the courses are free, and they can just come and join us. So there's no charge at all for dental students. So,
and I just want to at the end of this say my thoughts on the AGD. It was absolutely the best decision I made, because I came out of school, I opened up my own practice, I was 25, and I noticed every time I went to a CE event, it was the same dentist over and over, and they all had these funny initials behind their name, like FAGD, MAGD. And within a year, I realized this is the crowd I want to be with, because you're a summary of the 5 people you hang around with. And I would notice that when I went to an AGD meeting, what was more important than the information was meeting the person next to me. And I might have gone to this implant meeting and was listening to Carl Misch talk, but I was sitting next to this guy who was telling me all about something else that was totally unrelated. And it just changed the people I was hanging out with. Were all totally into dentistry. And as I look back at my neighborhood and Phoenix, the 32 years I've been here, and someone said to me, what is the main correlation between the people who had fun, happy, successful careers, or however they defined it? I would say it was the number of hours of continuing education you took each year, which got you out of your house and home and office into other like-minded peers. And so you might think you're a great dentist until you start hanging out with a bunch of people who have their FAGD and MAGD. Then you feel like you're never going to learn all of this. And it was just the greatest decision I ever made. And I argued with them tooth and nail. I have to admit my juvenile insanity, where I complained to the Arizona guy because to get my FAGD, I had to have these hours in these certain subjects. And I told him, look, I'm not going to do implants and ortho. I want to take that in fillings and bonding and crown and bridge and endo. And he said no. And I said, well, that's stupid. I mean, I'm not going to do it. I don't want to learn. But by forcing them, they forced me. I had to go learn this ortho and AGD. And even if you don't do it, your tool chest, your mind, I mean, if your only tool's a hammer, everything looks like a nail. And after just finishing the Misch Institute and Richard Litt's ortho deal to get my requirements, I only went there for my requirements, and we didn't have a dental school back then, so I had to get in an airplane and fly for this. Very mad about it going in. And after I got back, it's like, oh my God, the elders knew what was best for little Howie. And I'd say joining the AGD and getting my FAGD and MAG was the defining best decision I ever made in dentistry.
Yeah. Yeah. And, I always tell the story of coming from a small town and everybody was the same as me. There was no diversity. And, my yearly vacation was to St. Louis to the zoo, and I'd never been on an airplane, and I'd never had a taco. I'd never met a Jewish person. And true story. And
what town was this?
Southeast Missouri, Perryville, Missouri, down by St. Louis.
Wow.
Down by south of St. Louis, by Cape Girardeau. So I came to Kansas City and went to undergrad and went to dental school and joined the FAGD. And, I've seen the world. I've learned diverse people. I've become a great dentist. I met the friends of my life. And I've really learned to love my profession. I became a better teacher than I ever was before, because my mind was opened up, and it changed my life. And that was my message to the ASDA students this past weekend. It changed the life that I was able to have, and I've never looked back. So I feel the same way, Howard. It's been a real eye opener, and that's why I'm so excited to represent the Academy, because it's I'm able to give back to an association that gave me so much. So.
Well, it is an honor and a privilege to have had you as a teacher and on the show. Thank you so much for all that you have done for dentistry and continue to do.
Thank you. Can you believe that we were at the dental school together during that time? Isn't that awesome?
And my other teacher, Nancy Kassebaum, she's the dean of Colorado.
That was Denise Kassebaum. Nancy was one of the legislators. Do you remember that? She was a senator or something, right?
Yeah.
But this was Denise, and she's still the dean at Colorado. Good friend of mine.
And Marcia's and the dean at UMKC's a female woman, Marcia.
Yeah. Marcia Pyle is the current dean at the dental school. Yeah.
So, I used to love Denise Kassebaum. Denise Kassebaum, right?
Yeah.
How when you would ask her a question, she would first correctly rephrase it for you to help you learn how to ask a question, and then she would scientifically answer it. I just used to love it how all of her words were so exact, precise, and chosen.
She went to Houston right after dental school here. After she had taught here for a while, she went to I said Houston. It was San Antonio, and got her I think her certificate in radiology, and then went from there to Colorado and then worked her way up. And she's been dean there for quite a number of years. So yeah, she's at the top of her game for sure.
And that's another specialty that'll be challenged by technology as AI wants to start reading x-rays instantly.
Yeah, I know.
Everybody I know that's a Python programmer in AI doesn't want a human looking at the x-ray.
I know. So it's a real challenging world, but and that's what makes it fun. We don't want to stay the same. We want to be a changing force to the world. And that's what makes it so great.
Well, the dental world is greater because of you. So thank you so much.
Thank you, Howard. Same to you and all of your wonderful successes.
All right. Well, have a great day, and I will see you next time I see you. We'll both be gambling in Las Vegas.
I know. I hope you'll join us. It'd be so fun.
I will.
Thank you again.
All right. Have a great day.